my name is John Roxanne and welcome to my channel. So this is the third video of my OET preparation series. In my previous videos, I explained what OET is and shared my methods and strategies on how to answer the OET listening subtest. So if you haven't watched that yet, a link will pop up and I also put it down in the description box. And now, in this video, I will be covering everything you need to know about the OET Reading Subtest. But before I proceed, let me first thank OET for allowing me to use in this video the official sample tests, which you can see at www.occupationalenglishTest.org. Thank you, OET! So the OET Reading Subtest is divided into 3 parts, and there are a total of 42 questions, and the whole reading subtest will run for about an hour. So let's talk about Part A. In Part A, you will be seeing 4 different extracts, and there are 20 questions that you need to answer in 15 minutes. So the 4 extracts are under one healthcare topic, but each extract has its own focus or subject. Let's have a look. So all 4 extracts are under one topic, which is in this case, fractures, dislocations, and sprains. Each extract has its own subject, like text A is about definition of terms, text B is simple fracture of limbs, text C is drug therapy protocol, and text D is about technique for plaster backslab for arm fractures. Next, let's look at the questions. So there are 3 different types of questions in Part A. The first type is what we call the matching questions, or in other words, which text does it belong questions. So for this set of which text does it belong questions, what you need to do is first skim all the text and find keywords. So take note of the word I used, skim. Skimming is reading rapidly to get a general overview of the text. So basically, we just want to know what the topic of the text is, so there is no need to read it intensely. We just want to find out the subject of the text. So skim all the 4 texts and find keywords. The first step in skimming is reading the title, but since text A has no title, we can jump to the words that are in bold. So fractures, dislocation, and sprain. So fractures, buckle or break in the bone, following direct or indirect injury, closed, compound, dislocation where a bone is completely displaced from the joint, sprain, partial disruption of a ligament or capsule of a joint. So from what we've read, we can deduce that these are definition of terms. So text B, read the title first, simple fracture of limbs. So we have immediate management, clinical assessment, patient history, perform standard clinical observations, perform physical examination. So you have to examine this and check whether this. So still in text B, management, splint the site of the fracture, elevate the limb. If in doubt, treat as a fracture, administer analgesia, consider compartment syndrome, x-ray. Now, text C is drug therapy protocol. So we have the drug, morphine, the route of administration, the recommended dosage. And here we can see lower end of dose range in patients equal or more than 70 years. Advice can cause nausea and vomiting, drowsiness, respiratory depression, give naloxone. And lastly, text D, technique for plaster backslab for arm fractures. So when you look at the extract, these are actually steps, so I think you can skip reading it and just know that the subject of this text is about technique for plaster backslab. So after skimming the text and finding keywords, we now go to the questions and match which text it belongs to based on the keywords that we found in the text. So I'm going to show the questions and then show the four texts afterwards. So I squeezed the four texts in order for you to see them in one screen. So if that is too small for you to read, you can download the text and the download link is in the description box. Number 1, procedures for delivering pain relief. So keywords are pain relief. So when you look at the extracts, you can see that this info would be found in text C, which is about drug therapy protocol. So it's pain relief through drug therapy. Number 2, procedure to follow when splinting a fractured limb. So keywords are procedure to follow. So look at the extracts. Then you can see that this information can be found in text D, in which the procedures to do a backslab can be seen. Number 3, what to record when assessing a patient. So keywords are assessing a patient. So look at the extracts and their keywords. Then you can see that this information can be seen in text B because of the keywords of clinical assessment. Number 4, terms used to describe different types of fractures. So keywords are different types of fractures. So looking at the extract, you know that this info can be seen in text A because text A is about the definition of different types of fractures or definition of terms. Number 5, practitioners who administer analgesia. So keyword is analgesia. So when you look at the extracts, you know that analgesia can be seen in text C, which is drug therapy protocol. Number 6, what to look for when checking an injury. So keywords are checking an injury. So when you look at the extracts and their keywords, you know that you can find this info in text B because of the keywords check whether, and under this are the things that you need to check. And lastly, number 7, how fractures can be caused. So when you look at the extracts and their subjects, you know that you can find this information under text A, which is all about a definition of fractures. So fractures often occurred following direct or indirect injury. So that is how you would answer the first set of questions. Now we go to the second set of questions, which are questions with short answers. So there is a question and you will find the answer in the four text. So the first thing that you need to do is to know which text you are going to scan to find the answer. Remember that you only have 15 minutes to answer all of part A and therefore don't have the luxury of time to scan all the text, like going from text 1 to text 4 trying to find the answer. So what you need to do is know which text you are going to scan, and in order for you to do that, use the keywords like this. Question 8. What should be used to elevate a patient's fractured leg? So keywords are elevate a patient's fractured leg. So when we look at the extracts, so based on the keywords, we would know that we need to go to text B because text B talks about simple fractures of limbs. We would not go to text A because text A is about the definition of types of fractures, not text C because it's about drug therapy protocol, and definitely not text D because it's about plaster backslap technique. So now that we know which text to go to, we now scan it to look for the answer. So text B, immediate management, clinical assessment, perform standard clinical obs, perform physical exam, check weather, management, splint the site of the fracture, elevate the limb. Oh, there we go. Elevate the limb, a sling for arm injuries, and a pillow for leg injuries. So going back to the question, what should be used to elevate a patient's fractured leg? The answer is a pillow or just pillow. Number 9. What is the maximum dose of morphine per kilo of a patient's weight that can be given using the intramuscular route? So the keyword is morphine. So by knowing the subject of each extract, we know that we can find the answer in text C, drug therapy protocol. So we go back to the question, what's the maximum dose of morphine per kilo of the patient's weight through IM? So we go to the recommended dosage for IM, and then we can see here that it's 0.1 to 0.2 milligram per kilo. But what we want is the maximum dose. So the answer is 0.2 milligram. Number 10, which parts of a limb may need extra padding? So keywords are extra padding. Now, looking at the extracts, we can assume that we can find this info in text D because paddings are usually used in the application of a back slab. Now go back to the question, which parts of a limb may need extra padding? And now we scan the text for its answer. Measure a length of non-compression cotton stockinette. Wrap cotton padding over top for the whole length of the stockinette. Measure a length of plaster of Paris 1 centimeter shorter. Immerse the layered plaster in a bowl of room temperature water. Ensure any dribble is removed. Lightly mold the slab to the contours of the arm. Do not apply pressure over bony prominences. Extra padding. Okay, so extra padding can be placed over bony prominences if applicable. So the answer is bony prominences. Question 11. What should be used to treat a patient who suffers respiratory depression? So keywords are respiratory depression. Now we'll look at the extracts and the keywords that we found. Now we know that we can see the answer in text C because we actually found the words respiratory depression in text C while we were skimming it in the beginning. Now we go back to the question, which should be used to treat respiratory depression? And as we can see here, respiratory depression is rare. If it should occur, give naloxone. So the answer is naloxone. Number 12, what should be used to cover a freshly applied plaster back slab? So keywords are plaster back slab. So looking at the extracts, we know for sure that we can find the answer in text D because it talks about plaster back slab. So thinking about the question, what should be used to cover freshly applied plaster back slab? We can safely assume that it can be found in the last steps already because the plaster back slab has already been applied. So we just want to know what should be used to cover it. So scanning the text, let's go to the last step. Wrap crepe bandage firmly around plaster back slab. So the answer is crepe bandage. Number 13, what analgesic should be given to a patient who is allergic to morphine? So keywords are allergic to morphine. Now we go to text C because that's where morphine can be found, and then we scan it. Authorized indigenous health worker, nurse practitioner, drug, morphine, route of administration, recommended dosage, use lower end of dose range in patients more than 70. Advice can cause nausea and vomiting, drowsiness, respiratory depression. Oops, the answer is not here. So now we think, where else can we find the answer? So looking at the keywords that we found, we could go to text B because the management of simple fractures are there and giving morphine is a kind of management. So the question is, what analgesia should be given to a patient who is allergic to morphine? And now we scan for its answer. Management, splint the site of the fracture, elevate the limb, administer analgesia to patients in severe pain. If not allergic, give morphine. If allergic to morphine, use fentanyl. So the answer is fentanyl. Number 14. What condition might a patient have if severe pain persists after splinting, elevation, and repeated analgesia? So keywords are splinting, elevation, and repeated analgesia. So looking at the extracts in the keywords, we can assume that we can find the answer in text B because splinting, elevation, and repeated analgesia are all under management. So what we want to know is what condition might a patient have if severe pain persists after splinting, elevation, and repeated analgesia. So scanning the text, management, splint the site of the fracture, elevate the limb, administer analgesia, consider compartment syndrome where pain is severe and unrelieved by splinting and elevation or 2 doses of analgesia. So there you go. The answer is compartment syndrome. So that is how you would answer the short answer questions. Now for the last set of questions in part A, they are fill in the blanks kind of questions. So the strategy for answering these questions is the same as the one that we used in the previous set, which is knowing first which text to scan, and in order for you to do that, again, use keywords. Let's try it. Number 15. Falling on an outstretched hand is a typical cause of a blank of the elbow. So keywords are typical cause. So looking at the extracts, we know that we should go to text A because that's where causes of fractures can be seen. And now we scan for the answer. So fractures occur following direct or direct injury, twisting, violence to bones. Dislocation often results from injuries away from the affected joint. Example, elbow dislocation after falling on an outstretched hand. So the answer is dislocation. Number 16. Upper limb fractures should be elevated by means of a blank. So keywords are should be elevated. So looking at the extracts, we know that we need to go to text B since we actually saw the phrase elevate the limb while we were skimming the text in the beginning. And now we'll look for the answer. So elevate the limb as link for arm injuries or in other words for upper limb fractures. So the answer is sling. Number 17. Make sure the patient isn't wearing any blank on the part of the body where the plaster back slab is going to be placed. So keywords are plaster back slab. So for sure, we are going to go to text D because text D is all about plaster back slab. And now we scan for the answer. Measure length of non-compression cotton stockinette, wrap cotton padding over top overlap. Measure a length of plaster of Paris. Immerse the layered plaster in a bowl of room temperature. Ensure any jewelry is removed. Okay, so there it is. Ensure any jewelry is removed from the injured limb. So the answer is jewelry. Number 18. Check to see whether swollen limbs are blank or increasing in size. So keywords are check whether. So knowing the keywords in the extracts, we know that we should go to text B because that's where clinical assessment is, and we actually saw the keywords check whether in text B while we were skimming it in the beginning. And now we scan for the answer. So check whether the limb is out of shape, the limb is warm, the limb, if swollen, is throbbing or getting bigger, or in other words, increasing in size. So the answer is throbbing. Number 19. In a plaster bag slab, there is a layer of blank closest to the skin. So keywords are plaster bag slab. So definitely we'll have to go to text D because it is about plaster bag slab. Now looking at the question, there is a layer of blank closest to the skin. So closest to the skin would mean what layer should be applied first. So we're gonna scan for the answer. 1. Measure a length of non-compression cotton stockinette from halfway up the middle finger to chest. So that would mean that the first layer that should be applied would be a non-compression cotton stockinette. Number 20. Patients aged blank and over shouldn't be given the higher dosages of pain relief. So keywords are pain relief. So based on the keywords, we know that we need to go to text C, which is about drug therapy. Then we'll scan for the answer, and then we can see here in the lower part, use the lower end of dose range in patients more than or equal to 70 years. So the answer would be 70. That is the end of part A. Now let's go to part B. In part B, you will be reading 6 short extracts and they are relating to the work of health professionals. So for each extract, there is one multiple choice question like this. In the question paper, the questions and option will be shown first and below it is the extract. So it will be natural for you to read the question and option first because they are shown first. But I advise you to do otherwise. So what you need to do is ignore the question and options and read the extract first. By doing this, you will not be distracted by the options while reading the extract. Then after reading the extract, we now go to the question and options and then eliminate incorrect options to get to the correct answer. So why is it important to eliminate incorrect options? Because some of the options are mentioned in the extract, but they are actually contradictory to what is written, and some options are not even mentioned at all. So we want to make sure that what we answered is the correct answer. Let's try it. So ignore the question and options first, then read and understand the extract. So now we go to the question and then eliminate incorrect options. So number 1, this guideline extract says that the nurse in charge, letter A, must supervise the opening of the controlled drug cupboard. So we can eliminate this option because we didn't read this at all in the extract. Letter B should make sure that all ward cupboard keys are kept together. So as we've read here, the controlled drug cupboard keys should be kept separately from the main body of keys. So this statement is actually contradictory to what is written in the text. So we can safely assume that letter C is the correct answer. Can delegate responsibility for the cupboard keys to another ward. which we can see here in the last sentence. If necessary, the nurse in charge should arrange for the case to be held in a neighboring ward or department by the nurse in charge there. Ignore the question and options. Read the extract first. Now let's go to the question. When seeking consent for a postmortem examination, it is necessary to, letter A, give a valid reason for conducting it. So as we can read here, the person consenting will need an explanation of the reasons for the postmortem examination. So letter A is the correct answer. But we want to make sure that it really is the correct answer, so let's move to letter B. Allow all relatives the opportunity to decline it. So we can eliminate this option because it is actually not mentioned in the text. And letter C, only raise the subject after death has occurred. But as we can read here, there is no need to wait until the patient has died. So C is also an incorrect option. So now we are sure that letter A is indeed the correct answer. Ignore the question and options. Read the extract first. Now let's go to the question. What must all staff involved in the transfusion process do? Letter A, check that their existing training is still valid. So as we can read here, staff must ensure that if they take any part in the transfusion process, their competency assessment is updated every 3 years, or in other words, still valid. So letter A is the correct answer. Let's go to letter B. Attend a course to learn about new procedures. It says here that they should attend the mandatory training identified for their roles, but it didn't say anything about new procedures. So letter B is incorrect. And let's go to letter C. Read a document that explains changes in policy, which is not mentioned in the extract at all. So letter C is incorrect. Ignore the question and options. Read the extract first. Now let's go to the question. What does this manual tell us about spacer devices? Letter A. Patients should try out a number of devices with their inhaler. So, as we've read here in the last sentence, spacer devices should not be regarded as interchangeable. Patients should be advised not to switch between spacer devices.
So letter A is incorrect. Letter B, they enable a patient to receive more of the prescribed medicine. So we've read here, the device allows more time for evaporation of the propellant so that a larger proportion of the particles can be inhaled and deposited in the lungs. So letter B is the correct answer. Letter C, children should be given spacers which are smaller than those for adults. So this is incorrect because it is not mentioned in the extract. Ignore the question and options. Read the extract first. The email is reminding staff that the A. Benefits to patients of using bed rails can outweigh the dangers. So we've read here in the last sentence, staff should continue to take great care to avoid bed rail entrapment, but be aware that in hospital settings, there may be a greater risk of harm to patients who fall out of bed. So letter A is the correct answer. Let's look at letter B. Number of bed rail related accidents has reached unacceptable levels. So as we've read here, statistics show 44,000 reports of patient falls from bed annually, while deaths due to bed rail entrapment occur less than 1 every 2 years. So letter B is incorrect. Then letter C, patient's condition should be central to any decision about the use of bed rails. So this one has not been mentioned at all in the extract, so we can cross that off. Ignore the question and options. Read the extract first. Now the question, what does this extract from a handbook tell us about analeptic drugs? Letter A, they may be useful for patients who are not fully responsive. So as we can see here, respiratory stimulants in the short term may arouse patients sufficiently to cooperate and clear their secretions. So letter A is the correct answer. Letter B, injections of these drugs will limit the need for physiotherapy. So as we've read here, they must be combined with active physiotherapy. So letter B is incorrect. And lastly, care should be taken if they are used over an extended period. So this is incorrect because it is not actually mentioned in the extract.
So how was it so far? Like and share this video if you think this video would help you in your OET preparation, and click the subscribe button as well. Now let's go to part C. In part C, there are two long texts. There are 8 multiple choice questions per text, so a total of 16 questions. The good thing about the questions is that they will usually tell you which paragraph you are going to read. For example, so since you will know which paragraph to read, my tip is to read the question first and then followed by reading the paragraph that you need to. Remember that the text is long, like 7 paragraph long, so we only want to focus on the question that we are answering rather than reading the whole text and then get all confused. So what you need to do is read the question first and then read the paragraph that you need to and then match the answer with the options. So let's try it.
So in the question, you will see which paragraph you need to read to find the answer. So let's read and understand the first paragraph. Now let's go to the question. The writer questions whether letter A, adult ADHD should have been recognized as a disorder at an earlier date. So we can cross this option off because I can't remember reading anything about diagnosis at an earlier date. Letter B, ADHD should be diagnosed in the same way for children and adults. So it says here in the last sentence, it specifies that patients under 17 must display at least 6 symptoms of inattention and or hyperactivity. Adults need only display 5. But it didn't say that the writer is questioning this way of diagnosis, so letter B is incorrect. Letter C, ADHD can actually be indicated by neurological markers, but we've read here that there is a lack of any recognized neurological markers for ADHD, so letter C is incorrect. So letter D is the correct answer. So the writer is questioning whether the cases of ADHD have genuinely increased in the USA. Because as we've read here, it could be that the disorder is becoming more prevalent, or as it seems more plausible, doctors are making the diagnosis more frequently. In this question, it didn't say which paragraph you need to read in order for you to find the answer, but it's safe to assume that we are now talking about the second paragraph because we've just finished answering the question regarding the first paragraph. So now, let's read and understand the second paragraph. What does Dr. Saul object to? So, as we've read here, Dr. Richard Saul, a behavioral neurologist with 5 decades of experience, disagrees. Many of us have difficulty with organization or details, a tendency to lose things, or to be forgetful or distracted. Under such subjective criteria, the entire population could potentially qualify. So, based on this statement, Dr. Saul is objecting to letter C, the grouping of imprecise symptoms into a mental disorder. Because if that's the case, all of us could have a mental disorder. In this question, we can safely assume that we are now in the third paragraph. So let's read and understand the third paragraph. The writer records the study of children in foster care as significant because it, letter A, highlights the difficulty of distinguishing ADHD from other conditions. So, letter A is the correct answer because, as we've read here, researchers also found that children with ADHD in foster care were more likely to have another disorder, such as depression or anxiety. It could prove the nonspecific nature of the symptoms of ADHD. Anxiety and depression or an altered state can easily be mistaken for manifestations of ADHD. So, meaning there could be a difficulty in distinguishing ADHD from other conditions like anxiety and depression. So, letter A is the correct answer. This question is asking what the word they is pertaining to in the paragraph. And as you can see here, the word they is also underlined in the paragraph. So let's read. ADHD, the thinking goes, begins in childhood. In fact, in order to be diagnosed with it as an adult, a patient must demonstrate that they had traits of the condition in childhood. However, studies from the UK and Brazil, published in JAMA Psychiatry, are fueling questions about the origins and trajectory of ADHD, suggesting not only that it can begin in adulthood, but that there may be two distinct syndromes, adult onset ADHD and childhood ADHD. They echo earlier research from New Zealand. So, based on what we've read, they refers to the studies from the UK and Brazil. So, letter C is the correct answer. We are still at the fourth paragraph. So, read and understand the fourth paragraph. Dr. Farone suggests that the group of patients diagnosed with adult onset ADHD, letter A, had teachers or parents who recognized the symptoms of ADHD. So, supportive parents or teachers are mentioned here in the paragraph, but they weren't the ones who recognized the symptoms of ADHD, so letter A is incorrect. Letter B should have consulted a doctor at a younger age. So we've read here, there may have been signs that things weren't right, but not enough to go to a doctor. So, letter B can be an answer, but I'm still not confident about it, so let's go to letter C. Had mild undiagnosed ADHD in childhood. So we've read here, the researchers found a group of people who had subthreshold ADHD in their youth. When the scaffolding is removed, full ADHD could develop. So based on this, I would choose letter C as my answer rather than B. So letter C is the correct answer. Next, let's read and understand the fifth paragraph. In the fifth paragraph, it is suggested that drug companies have, letter A, been overly aggressive in their marketing of ADHD medication. So we can cross this off because I don't remember reading this in the paragraph. Letter B, influence research that led to the reworking of ADHD diagnostic criteria. So as we've read here, in many instances, the evidence proffered to expand the definitions, that is, broader definition of ADHD, came from studies funded in whole or part by manufacturers. So, letter B is the correct answer. Since the studies are funded by the drug manufacturers, it influenced the research regarding the ADHD diagnostic criteria. This question is asking what the word trademark refers to in the paragraph. So let's read. This brings us to the issue of the addictive nature of ADHD medication. As Dr. Saul asserts, addiction to stimulant medication isn't rare, it's common. Just observe the many patients periodically seeking an increased dosage as their powers of concentration diminish. This is because the body stops producing the appropriate levels of neurotransmitters that ADHD drugs replace, a trademark of addictive substances. So, based on the statement of the body stops producing the appropriate levels of neurotransmitters that ADHD drugs replace, I would answer letter a physiological reaction. Now, for the last question, let's continue reading the last paragraph. In the final paragraph, what does the writer imply about addiction to ADHD medication? Letter A. It is unlikely to turn into a problem on the scale of that caused by opioid abuse. But we've read here that the abuse of drugs used to treat ADHD is no less a threat. So letter A is incorrect. Letter B. The effects are more marked in certain sectors of the population. So I'm gonna go and eliminate this option because I can't remember reading about this. It does say here in the paragraph that it can be abused by students seeking to improve their focus or academic performance, but it didn't say that the effects are more marked. So letter B is incorrect. Letter C. Insufficient attention seems to have been paid to it. So as we've read here, much has been written about the staggering increase in opioid overdoses and abuse of prescription painkillers in the USA. But the abuse of drugs used to treat ADHD is no less a threat. The writer is implying here that much has been written about the opioid overdoses and prescription painkillers, but insufficient attention seems to have been paid to the abuse of drugs for ADHD. So letter C is the correct answer. So that is the first long text. And then there's another long text with 8 multiple choice questions, and for you to answer them, just apply the strategies that we just used in answering the first text.
So that's it. I hope these strategies would be helpful to you, like it helped me when I took my OET. So type some comments below, like and share this video, and consider subscribing to my channel so you will be notified when my video about OET writing is up. Thank you so much!
Was cold at night when you came into my troubles all night.